So, Knox, I just want to make sure that I have everything here as far as through the history and examination to completely understand what's going on with your situation. That way, I can better help assess you for your overall treatment. So, currently, you're having some low back pain, which has been going on for about 6 months. This low back pain is more painful on the right, but it's painful on both sides. And this pain in your low back is more kind of local. It doesn't travel anywhere. The pain doesn't travel anywhere. It just kind of stays local to that low back. Um, this is something that you're concerned with because it's been going on for, as you said, for 6 months, and it's affecting some of your normal daily activities, especially at work, which is something that you've mentioned as being busier here lately with the busy season. Um, as your job pertains. This is something this low back pain. This is something that came on without any type of cause, without any type of trauma or anything of that nature, and it's something that hasn't been getting any better, even with the use of NSAIDs, some ibuprofen. I'm assuming, and the only relief that you're getting from this pain is from what you quote as poor posture. Um, so rounding the back, and this is something that you don't want to do, and it's something that you don't want to continue to do because you understand that that's something that's not good for your overall health of your spine, which is good. I'm glad that you understand that and you're being proactive about it. But you've had some imaging, and that all came back clean. There's nothing on that imaging that states that you've got something structurally going on as far as that's concerned. So that's good. It's good to see. Um, things like standing for a few minutes at a time, backward bending while standing, some in range prone extension, and those movements and patterns are all something that makes the pain worse, from my understanding, correct? And so, based off of the exam findings that we've got today, and your current situation, what I believe could be causing your low back pain is what's something that's called lumbar facet syndrome. This is something that isn't uncommon, and I believe that based off of the history that you provided with us today, your history of your daily routines, your work habits, and the exam findings from the exams that we did for you today, I believe that this is something that's most likely causing your pain. So, with that said, I know that you have a lot going on right now, especially with the amount of time that you're putting in at work, 65 plus hours. I could only imagine. That's quite a bit of time spent dedicating to your job, and um, I just wanted to give you some recommendations that I think could help lessen the degree of stress and anxiety that you've been going on because you've made some concerns. You've pointed out some concerns that you've had. Um, and I know that you mentioned that you feel like being more active is something that would make the pain worse, but I'd actually like to recommend you seeking more form of activity, so more forms of types of exercise, but something that doesn't cause you any harm, doesn't cause you any more pain that you already are in. Exercise is actually shown to reduce the amount of stress and perceived pain that we go through on a daily basis. So, given that and what I believe is causing your low back pain, exercise can only improve that. It could, not only help with the daily stressors and things of that nature, but strengthen some areas that could be weakened. And balancing some things out within your body. So, honestly, I think that's the best way to go. Get a little bit more active. It doesn't have to be strenuous. You don't have to be working out in the gym 1 hour a day. Go on a 15-minute walk. Something really really simple, but just get out there and be more active because I think that'll help you overall. Progressing through your treatment plan. Some other recommendations that I like to do are some exercises. Again, like I mentioned, exercises are going to help strengthen some areas that could be weakened. And that they're going to help with the adjustment along the way because I do believe that you're a prime candidate for chiropractic care. So the first exercise actually I'm going to demonstrate for you is what's called a posterior pelvic tilt. And it's simply just as it states. So what we're going to do is we're going to lay face up, and what I'm going to have you do, laying face up with your feet flat on the ground, knees at 90, is you see this here? We've all got kind of like a space in our low back when we're laying on the ground. So what I want you to do is imagine that space in the low back between you and the ground, and what I want you to do is flatten that flatten the spine to the ground by using only your hips. So what we're going to do is we're actually going to rotate our pelvis and flatten out that curve. The next one I'm going to have you do is called a partial dead bug, and we can progress with this. But again, we're going to be laying face up with our knees at 90, feet off the floor this time. Arms straight up, and we're going to extend one leg at a time. And then from that, we can progress to adding some arm movements. So a cross crawl pattern. And we can do that for a number of reps and continue moving through those progressions. And then the next one is what I call push-through crunches. So we're going to be doing an abdominal crunch, and the push-through method is what you're going to do is we're going to be laying face up, feet flat on the floor. We are actually going to literally push through our legs here. So we're going to crunch and push through. Working on these core muscles here. That way we can build this up while we're also working the low back area out as well. But as far as everything's concerned from today's visit and the history provided and the exam results, like I said, I think you're a prime candidate for chiropractic care, and I believe that with chiropractic treatment, we'll get you on the road to better health and decreased pain. So looking forward to it.